a lot has happened since August. As many of us might recall, although it seems like it's been an eternity now, our government was shut down, and over taking the question of whether or not health care reform would be repealed as hostage. So, I mean, we were right in the center of that debate in terms of whether or not our country was going to go forward with any sort of government in the future, which of course all of us believed that eventually there'd be some kind of compromise and we'd move on, or whether or not we were going to stay in the thick of this debate, which I think is just the can being pushed down, the corridor for another day of debate on this very hot subject. In the meanwhile, October 1 came, and October 1 was the effective date of the open enrollment period under the use of the federal exchanges and those states that adopted state exchanges under the auspices of the Federal Accountable Care Act. So October 1 came and went, and as most of you are aware, you don't live under a rock. At least you wouldn't be on this commission if you did live under a rock. So you're quite aware of what happened, as could be expected with anything that was that large and that massive and had that many people who were interested in perusing, as it were, if not actually enrolling between the October 1 and March 1 deadline for enrolling for this next year, with the January 1 deadline to try to get everybody online for new insurance. It crashed. Hello, were we in the least surprised about that? So while the exchanges are being, shall we say, greatly repaired, or hopefully greatly repaired, or something happens with regard to the exchanges, we're going to have, I think, an amazing set of presentations today about what Louisiana is doing on the ground. So we'll have reports from the Louisiana healthcare carriers that are actually qualified to and participating in the exchange. We'll have reports from the navigator entities who are getting the calls and hopefully helping people along. We're also going to have a report on federally qualified health care centers, enrollment and outreach, and an update on the department's activities under the Affordable Care Act.
We're in an interesting business and an interesting time, and a lot of the systems seem to be working very, very well on the private sector side, but not so well on the government side. At the end of the first week of business, I had dinner with a fellow CEO of one of the plans that's in the the federal facilitated network and our marketplace. And at the end of the first week, I was ahead of him 2-1, so I felt real good. Haven't talked to him since then, so I don't know where they stand, but I feel pretty confident in saying that everybody is experiencing pretty much the same things that we are experiencing at Louisiana Health Cooperative. Our internal systems are working. We know that people are calling. We know that people are interested in our plans. They're asking questions. They're going to our website. They're calling our 800 number. When they go into the federal marketplace, some are even having success enrolling. The problem occurs is after they hit the button to say execute and it sends their data into the system, it's not filtering down to the plans to follow up. So we've got people that are calling us and wanting to make premium payments, but we can't find them in our system. We know that they've enrolled in the federal marketplace. They got the email message back that they were good and in, but it's not complete. The loop's not complete because it's not getting down to the insurers. We can't tell them what kind of a premium to send us or a payment to send us because we don't know that they're in the system, what level of coverage they are at, what subsidy they are eligible for. So we're kind of at a loss. We know that there are people out there that are engaged in trying to get to us as insurers, but are struggling to be able to get there. On the flip side of that, we are helping some folks when they do call us, get into the exchange, but most of our success has been fairly late at night when the airwaves seem to be moving a little bit smoother. In the last week and a half, it does seem to be progressing a little bit better. I know that they're trying to do things in Washington to improve the access and the data flow through, but it's not significant at this point, and we are not our numbers are disappointing, to say the least.
We're just basically playing the hand that we've been dealt. Like everyone else, the website that's going on to healthcare.gov and actually having the ability to enroll or have your agent get on there and help you enroll has been dismal so far. The numbers we've received have been small. So a lot of it, of how this thing is going to work, I basically think at this point is going to determine how fast we can get the website up and running. I can tell you right now that our customers are stressed out, our providers are stressed out, our brokers are stressed out of how fast can we get this done and what it actually is going to happen. There's still a whole segment of the population that is holding on for either delay of the bill or that it's just going away altogether. I don't think that it's going to go away altogether. There may be something where they may have another delay. But I don't think we need any more big changes. We need to fix what we've got and continue to educate. We still have a large segment of the population that do not realize that on the healthcare exchange you're buying from private companies. They believe that the government came up with one plan and you got to go get that plan, which is not the case. I do like the form of an exchange. I think in the competition realm of it, I think if you look at how Part D works with prescription drugs for Medicare recipients and Medicare Advantage, if you look at how that kind of an exchange is set up, the private companies do go after one another to try to entice members to join their plan. And I think if we can get the website working, give it a little time and just fix what we've got, that hopefully the competition in the market, the Health Co-op and Blue Cross is a fierce competitor. They're not going to give me anything. I have to go earn it, and vice versa. They're good folks, and same with Humana and United. So I think we just need to fix what we got. I don't think we need to make any more big changes. If we could send a rocket to Mars and land it, and it door opened and this little four-wheeler's running around looking under rocks and sending back soil samples, we ought to be able to fix this website. I can't do either one of those, but hopefully there's somebody out there in America that can.
For many, many months, if not more than years, in preparing for the October 1st deadline that we set for ourselves, but we all recognize that that was the first of many upcoming hurdles. And so while we knew October 1 was a very large date to be thinking of, I think we all need to be careful of putting too much stock into the success over a 2-week period and trying to extrapolate that forward into what this experience is going to be for our consumers. So our responsibility as the private insurer is really to be prepared, and to be prepared when things that are out of our control are fixed so that we can continue to provide the right level of service for our customers. And we think that we've been doing that. We have 39 plans available across all metal levels in every parish across the state, of really every type. And we are in a position where we think we can meet the needs of a real wide variety of local residents. As we just heard from the other two plans on the exchange, a lot of calls, a lot of inquiries, certainly a lot of investigation, a lot of false attempts of signing up. A very, very small number have gone all the way through to payment. We certainly have more signed up than have paid as of this point. For the most part, what we're getting is mostly error-free. If there are errors, they're more technical in nature, so we're feeling like that's going to get resolved once we get the bandwidth issue and the execution of the website resolved. I think, as I said, it's important that we don't look backwards and we continue to look forwards and remember that our members have until December 15th to sign up for a January 1 effective date. And so while I think these past couple of weeks have been disappointing in terms of the volume and activity, November is going to be very telling. And if we can get things resolved over the next week or two, I think we'll still allow the system to sort of reach those levels that we were planning for it to reach. And then, of course, open enrollment goes through the end of March. So we're at the very beginning here. Anxious to see if things are fixed and how, and if the tech surge is gonna solve any issues. But if it does, we will be ready.
We have found a tremendous response to this. The phone calls have just been overwhelming. People finding our office. People are very, very interested in this. We thought that we would be doing a lot of outreach to our partners throughout the 13 parish area. Everybody knows about this. We really haven't had to do outreach. Because of the problems with the website, we've been mostly doing education, answering questions, a lot of paper applications, pointing people to telephone lines where they could make application with the federal government by phone. I guess my navigators have completed probably around 24 enrollments, and in our application we said that we would do 2,000, so we're way behind. But my navigators, I'm very proud of them, are very upbeat and optimistic and have kept our callers and clients from panicking that, okay, now here's somebody who knows something and is going to help you, and just call back in a few days and we'll let you know if it's working any better. We can answer their questions. Now they know that, yes, this is something for me, and sooner or later somebody's going to help me get it. I think the fact that there are still 4 or 5 months of this open enrollment period, we're able to reassure them that we'll definitely get you what you need, get you what you're looking for, in that time period. We're just assuming that that will be enough time to get everything done.
My name is Brian Burton. I've been employed by Southwest Louisiana Area Health Education Center since 2004. I'd like to start off by saying that it can be a little bit confusing because it says Southwest Louisiana. When I applied for this grant over the summer to serve as a navigator entity, I applied on behalf of all 4 of the area health education centers in the state. We are the lead agency. I serve as the state director, so because I'm employed by Southwest Louisiana, everybody kind of hears about Southwest, but we are a statewide entity. AHECs, or Area Health Education Centers, were founded in the early 70s by Congress in order to meet a lack of, or a disparity in healthcare professions across the nation. And we, in Louisiana, there are 4 different area health education centers. There's the North Louisiana Area Health Education Center, which covers the Monroe and Shreveport area. There's the Central Louisiana Area Health Education Center, which focuses on the Central Louisiana and the Alexandria Baton Rouge area. Southwest covers Lake Charles, Lafayette. Southeast covers the New Orleans, Houma, Thibodaux, Bayou Land area. So together, between the 4 of us, we have a consortium called Navigators for a Healthy Louisiana. Our goal is to go out there and to help provide health education, health literacy to people, especially those that are entering the insurance marketplace for the very first time. We are a non-political entity. We have no dog in this hunt. We know that we're going to let the politicians play it out. If we were not providing health literacy on the Affordable Health Care Act, we would be doing what we've done for the 22 years of existence in Louisiana, and that is providing health literacy on any other type of health disparity. We look at lack of insurance as a form of health disparity, and so our mission is to get out there and to help everybody. We have navigators throughout the state. There are a total of 19.6 FTEs in our program. The state of Louisiana received $1.7 million as a state entity to have navigators in position. We received 1.1 of those $1.7 million, so we kind of received the lion's share of that project. As soon as we were awarded the grant on August 15th, first thing I did was reach out to the other entities so that I would be able to find out what target populations they had, knowing that there's enough work for all of us in the state so that I could let Linda and Jordan focus on the communities that they're working with, and we can work to figure out, fill in all of those other gaps. But with 19 people, including myself, serving as navigators, there's no way that we are going to be able to help all the people that are seeking information and enrolling in the marketplace. So for us, what has been important is the establishment of collaborations throughout the state. Besides the navigator entities, there are certified application counselors, whether or not they are through the federally qualified health centers, they are through the rural health centers, or they are through any other nonprofit or the hospitals. Our real goal has been to identify who all the players are that can assist people with that help with navigating through the marketplace, and so that we can kind of be the outreach arm. We're the ones that are going out into communities every day providing education on the Affordable Health Care Act. Everything from Insurance 101 to what types of plans are available. We are finding ourselves really having to break it down to some very elementary education, explaining to people what is the difference between a premium, what is the difference between a premium and deductible, a copay and co-insurance. So we're really focusing on providing very basic health literacy information as people enter the marketplace. But then what we do is what's really important is that we can refer people out. Yes, each one of our navigators have an obligation to help people enroll. But knowing that it is going to take anywhere from an hour to an hour and a half, depending upon that literacy level of the family or individual you're working with, there's no way that we can do it all. So it's really about, for us, leveraging who our partners are in each one of the different communities so that we're able to get out there and provide that education and send the people out to where the other people who are sitting behind a desk waiting for, who do not provide outreach, but rather inreach, waiting for people to come in and become enrolled. And so that has been what our real focus has been about. We want people to make an informed and educated decision about what is best for their family, and not a fast decision about what is best for their family. So take the time while the federal government gets their systems in place to be educated and know what is available. But in the meantime, we've also found other avenues, and I'm sure as we get to questions, we'll explain what those other avenues are. You know, in Louisiana, we are an extremely, we've learned after Rita, after Katrina, what we've learned is we are a community that picks itself up by our bootstraps, and we go on, and we do not wait for the federal government to come in and to fix our problems.
Our patients are the primarily uninsured patients, and that's been our target population thus far. Many of these people have never had health insurance, so we've had to have very basic conversations going through the terms. We accepted the Navigator grant because we wanted to be in the best position to help our patients, number one, understand their rights and responsibilities under the new health care law. With our grant, our audience has been expanded to the Bossier, Caddo, and Webster parishes. Our experience has been a little bit different than Ms. Linda's, and the calls have been very sparse coming in. Thus far, we have done paper applications for about 20 consumers. Many of those have never had health insurance. Most of the people that we worked with, they have to do the paper application, so that gives you kind of a sense of the people we're working with. We have offered to help them set up their email accounts to go through the online application process when that's set up, but most of them don't want anything to do with that. They don't have access to computers, and that has its own implications right there because they're not going to get real-time numbers. And then to get the information, it has to be mailed to their home address, but that changes week to week. So we have a lot of different experiences up to this point, but we are very excited about the conversations we're having. Like I said, we haven't had that many calls, which is a little bit unexpected for us, but we're working on the outreach side. Thus far, we've done about 4 different presentations in our community. We have a dozen lined up for the next month, and we've done everything from meeting with the LSU Center or the LSU Shreveport Satellite Campus. We've done business women's associations. We've done presentations lined up at libraries. We've done family dinners at churches. So we're trying to get a broad range of people to have this conversation.
I know that we have some FQHC representation on the commission, but just for the sake of context, there are 28 FQHC organizations in the state that operate over 100 sites. We were just talking about the Medicaid versus the non-Medicaid eligible. Approximately 40% of our 250,000 patients are on Medicaid, but also about 40% of that 250 are uninsured. So with you taking that to account, we're natural to be very interested in insuring anyone that may qualify. But at the same time, 75% of that 250,000 people are below 100% of poverty level. So, you draw your little Venn diagram, and there's a significant amount that are going to be very interested in receiving insurance, but there is no insurance option, or at least no subsidy for that insurance option. So just overall, the FQHCs are funded for outreach and enrollment around the ACA from a slightly different pot than the navigators. I think you guys are funded through CMS. We're funded through HRSA. So I think Louisiana received, like Brian was mentioned, 1.7 million. The health centers in Louisiana received about 2.6 million, and that is really based on the number of uninsured that we served. So when we were talking about what does success look like? Nationally, we weren't really sure. But through our application process for this funding, we, confirmed to HRSA that we would hire 59 certified application counselors, which are somewhat similar to the navigators, again, slightly different training process. And then we would assist, not enroll, but assist 93,000 people. So that just means that we assist someone making a decision along that process. Because like they said, this is an enrollment process. We can't force anyone. We don't make the decisions for them, press that button. We also understand that a lot of times, like they said, you go to the website repeatedly. You may want to go visit a navigator or a counselor repeatedly before you actually make that decision. So we don't want to get any of those processes lost, so to speak. So I think that we've had some form, on one level or another, collaboration with all the earlier panelists. We're working not only with the plans to understand their product, but working with the navigators, simply because we didn't want that day to come that they were in room A making a presentation and we were in room B. So there's been a real outreach, and I appreciate, Brian, their group, and establishing the regional collaboration so each one of our individual health centers can participate on a local level. Again, we participate on a statewide level, and in addition to weekly HRSA and CMS calls, our PCAs, there's one in every state, we talk to each other as well. And the issues that we're facing here are being faced all across the country. Those states that are operating a state-facilitated marketplace, their website seems to work a little better. I don't know why the federal government didn't go to Google or eBay or someone that had a lot of experience and knew the expectations on the other end. And we were talking about how many times it takes to go to a website. I understand 19 million people visited the website on the first day, and quietly it was estimated that 18 million were probably reporters. So, so it is really, we are stressing education now until the beginning of December. We don't want to force our population to a website that doesn't work. We are having some success enrolling people over the phone, although that really depends on how much time that person on the other end has and their level of capacity. We've got anything from they walk through the entire process at one phone call to, can I get these 5 questions answered and we'll call you back in 2 business days. Where that phone number might be, whether or not you're still interested, that's yet to be seen. So we're getting a lot of the same comments that the navigators are getting. We are running, again, into some folks that have the expectation that this is free on some level and that they just don't understand copays and deductibles. And again, so it is a lot of health literacy 101. We do have many Medicaid eligibility specialists already housed in the FQHC. So this process, and that, in addition to the Bayou Health implementation, a lot of this is we're kind of feeding off those experiences about what questions to anticipate, how long does it take to explain through this. So again, we expect there'll be another big media push when the website is fixed. And we're looking at that December 15th date. I did see last night the federal government did push back 6 weeks as far as before you begin incurring that penalty. So that gives us a little longer window, but certainly, we've held these dates up, December 15th and January 1, for so long that we don't want to vary from them too far.
What we did is we approved 21 standalone individual dental plans. In the small group market for dental, we approved 26 plans. In the individual major medical area, we have 77 plans approved. And the small group major medical area, we have 45 plans approved. What has surprising to me is that we're not getting the calls that I expected. We really worked hard to learn all the PPACA to assist the consumers, but thus far, for the month of October, we only received 199 calls. Most of those calls are related on how to get on the website, and because they have pre-existing conditions. However, we have received stats from the federal government, whereas they have received for the month of October a little over 22,000 calls for the state of Louisiana. So that's an indicator that our people are going to the federal government for assistance.
They perceive the navigators as a direct competitor with the in the health business. As a result of that, several states enacted comprehensive regulatory statutes that actually regulate the navigators in much the same way as health producers are regulated in the various states. We also had a comprehensive bill that was filed. However, it did not pass through. And toward the end of the session, we had Senate Bill 101 modified to include an 11-line entry that authorized the commissioner to promulgate rules or regulations to register and regulate navigators. Prior to the implementation of that regulation, it had to be reviewed by a joint committee meeting of both the House and Senate oversight committees. That committee meeting was convened on September 17, and following the department's presentation of the rule as, or the regulation as drafted, they had to hear it. And well, following our presentation, they had some questions, and fortunately, Brian Burton was there, and he stepped up and shouldered the great responsibility of addressing the multitude of questions that came from the joint committee. Did an excellent job. To my ears, what I heard more than anything else coming from them, and correct me if I'm wrong, was essentially how are the navigators going to, in their outreach program, how are they going to get the word out to their constituents in the most rural portions of the state. And he did an excellent job of addressing that, and I think he did a good presentation here today that kind of addressed that as well, doing the outreach and all of that. In the end, the draft regulation was approved by the committee, and it has since been promulgated as Regulation 101, went into effect 5 days ago. However, prior to that, the registration portion of that has been in effect, and we don't have Southern United Neighborhoods here represented today. They are out doing outreach, but each of the 4 entities have complied with the registration requirements of the regulation, and they are all good to go. One of the things I think that was of most concern to the producer base was whether or not the navigators were actually going to present a hurdle, if you will, as to the ability to enroll. I think there was an equating of the word enrolling with the sales of the policies that the producers are engaged in. However, I don't think that has come to fruition. As Brian said earlier, I think he said, what, 19.6 people? And I think with the, and Linda said she had 2 and 2 on standby. And Jordan, I don't know if you had mentioned how many navigators you have.
4.
4. I know Southern United Neighborhoods has maybe 10 or so. So we're probably looking at less than 40 navigators statewide. So I don't think that's going to really cause a concern with the producer force. One of the things that we have heard today is a reference of referring people back and forth from the navigators to the CACs. Didn't really hear a whole lot about referring individuals to the producer force, and I will say this. I don't think that there is a mechanism whereby they can refer an individual to a particular producer. I have gotten a call from the Shreveport area, I don't recall who it was that made it, but asking me if I had a list of producers that have been certified and authorized to sell on the marketplace. We did not. Following that call, we just don't have a mechanism to do it. What they do is they go to the CMS learning site, they take the training on the website, and they are given their, I'm not even sure what the certification number is. I don't know if they're using their national producer number along with a password, but I'm not really sure how that works out, and Renell, you might be able to address that in a little bit. But one of the concerns is that I called HHS, and I called CMS, and I called some of the other agencies that Emma is routinely in contact with, and I asked if they could, since they had the information, provide us with a listing of all of the producers in the state of Louisiana that have been authorized to sell on the marketplace. And they said they would study that and get back to me. They got back to me, and they said that if they released that information to me, that would be a violation of the producer's personal identifying information, and they could not let me know that. And I assured them that every producer in the state of Louisiana who is authorized wants their name out there. And to date, they've not yet provided that information. So I have tried to get that information in other ways. I contacted Renell via email, since she does have a Health Agents for America, and a good number of the people who are producers in the state of Louisiana are members of her organization and are working to do that. However, we have decided that probably the best way to go about doing this is we have here at the department an industry access portal, which everybody who is part of the agent force or anybody who is licensed by the state of Louisiana has an agent number or a producer number. And what we're going to do is enlarge that so that the people who are authorized to sell in the marketplace can come in and input their information, and that database is searchable not only by name but by region of the state. And so when the time comes, if you need to refer somebody to a producer, or you can go and print a list of, certified or authorized producers in your area and just give a general listing of everybody. So you don't have to, say you can't do it. Because what I understood was that the remark, apparently, there was a producer who went to one of the Navigator entities with a stack of cards and said, if you need to refer somebody to a producer, you can do it to me. And the comment was, I can't do that. If I do that, I run the risk of losing my federal grant money. So they can't refer to an individual producer, but I think, by making available a general listing of everybody in the area, that would be sufficient. With regard to agents, well, the increasing or the improving our industry access portal was a good bit of what I wanted to address. And then the other thing is we're seeing now a reporting. We can't go out there and search all of the website names, and people are very creative when it comes to developing websites, trying to position themselves in a profitable manner in light of the marketplace. New Hampshire recently issued a cease and desist order to a website there. The name of the website was NewHampshireHealthExchange.com. They cited the site as being deceptive and or misleading, although, like us, they are not members, they're members of the federally facilitated exchange, and they go to healthcare.gov. So I personally didn't see that the NewHampshireHealthExchange.com website was problematic, since it didn't mimic the healthcare.gov website, but they said that they determined that the name was deceptive or misleading, and had the individual take it down. I think one of the complicating matters in that particular instance was the fellow who operated the website was out of Arizona, and he was not even licensed in New Hampshire, and I think that played a large part in their decision. Other than that, we do have some websites, and we're trying to make a determination as to, what we're going to do with websites that may be perceived as being problematic only in name, whether we have people take them down or we just have them include a disclaimer or disclosure that they're not part of the healthcare.gov website, but they are actually a independent website just doing business in the state of Louisiana.
We were talking about the Affordable Care Act's implementation. Where are we in terms of the exchanges, whether or not people in Louisiana are aware of what's available to them on the exchanges, how to access affordable health care through the exchanges, and the navigators that we have in the state of Louisiana to assist them, either by paper or through the healthcare.gov website. We found today that, of course, like the rest of the United States, Louisiana is also impacted by the difficulties in getting this website up and running. But as the bugs are being fixed, we find that there are so many people that are very, very interested in getting access to good quality health care in the state and health insurance. And some of these people we've learned for the first time, so they don't really know a lot about what health insurance provides for, because it's not a marketplace that's been, frankly, open to them. So it was a very exciting meeting. I, frankly, learned a lot from the experts that are seeing firsthand what's happening in Louisiana, or putting a face to the people that have been uninsured in Louisiana for so long.
Okay, and if people would like more information, where can they get it?
Well, they can get information by going to the Louisiana Department of Insurance's website. There is a consumer information site there, and we'll get that information to you so that you'll have it to put on your, to give to the consumers in Louisiana and to the people of Louisiana. They can also go to healthcare.gov to get information. They can go to the different navigators. We have we've given out some information today as to the 4 navigators in the state that received grants to do nothing but help educate the consumers in Louisiana, including those in rural areas, those that are in places that are difficult to get access to the information. Some people don't have computers. Some people are not computer literate. We learned today that there's a way that you can just apply with paper, like real paper again, and that works just fine, and it goes to a central source within the government, and that people will hear later on as to which of the plans are going to be made available to them that they can choose from.